Does Alzheimer's disease run in your family? Even if it doesn't, the incidence of Alzheimer's is increasing. Currently, it's 1 in 9 adults over the age of 65, which is 11% of the population. But this is expected to double in the next 30 years, so that's concerning. 2/3 of those suffering are women, so there seems to be a sex component to it as far as female sex hormones versus male. This is a similar ratio with autoimmune disease, so we women definitely are more afflicted on this inflammatory profile because Alzheimer's has a lot to do with inflammation, and it has a lot to do with gut health, my favorite topic. So I wanted to dive into it a little bit today because the drugs for the disease really have been shown to be ineffectual. So sort of waiting for that, waiting for the diagnosis and then hoping that there's going to be some breakthrough in drug therapy. It hasn't happened yet, and it makes sense why it hasn't happened because Alzheimer's is a multi-factorial problem, meaning it's not just one aspect of your health and life that's affecting your risk, but many, many factors. So that's what I want to jump into. Now, I definitely hear from patients sort of the fear factor of like, I don't want to know. I just, let's not think about it. Not a good thought process because it's deemed that it's a 20-year process of developing the disease. So if you're, in your 60s, typically when it's diagnosed, that means you're in your 40s, sometimes late 30s, when things start to develop. So there's so much we can do. Now, Dr. Dale Bredesen, who wrote The End of Alzheimer's many, many years ago now, and has continued his research, he has recode and pre-code for, restoring the function to the brain. He says that if we started early enough, there doesn't need to be anyone, in quotes, that has this disease, or it should be a very rare disease because there's so much that can be done leading up to it that will steer you away from developing it. So that's exciting. So that's the good news that I want you to focus on, is that it is worth it. And the beauty, like so many of the things we do, is that when you're preventing one thing, you're taking these steps, and I'm about to go through to prevent Alzheimer's, you're also moving yourself away from diabetes and cancer and cardiovascular disease. So they're the same steps, so you might as well do them and start early so you don't have to, go down this horrific road of Alzheimer's. So I mentioned the statistics. One of the things that's easy to do and is important is to check out your genetics or your epigenetic profile. Now, there are genetic tests that you can do, and it's just a simple saliva swab, so nothing invasive. And what you're looking at is what's called the ApoE4. So it's capital A, then PO, and then capital E4. So that is a gene variant that depending on how many copies of it you have, really increases your risk. So that's often, again, the thing that patients say, I don't want to know. But it's worth knowing because you want to know how vigilant and how aggressive you need to be. So if you have one copy of this gene, which is called heterozygous, then you have a 2 to 3 fold increased risk. But if you have 2 copies, you have an 8 to 12 times increased risk. So 1 should get your attention. 2, you should really make big efforts across the areas that I'm going to be talking about to really optimize your health. And again, just because genetically you are more at risk, it doesn't mean you have to get there, especially if you do these underlying changes that again will make a difference in your whole health profile. Okay, so the first one driving Alzheimer's disease is inflammation. We hear about inflammation all the time. It's the factor that's leading to all degenerative diseases, and that all is not an overstatement. So again, whether it's Alzheimer's, any kind of cognitive decline, you're trying to avoid diabetes, you're trying to avoid cancer, heart disease, you want to handle inflammation. So you want to get to the root of that. Now, what drives inflammation? Certainly a bad diet does, but having toxins or infections you're not aware of. So some sort of chronic toxic exposure in your gut. So you have parasites or amoeba, or you have bacteria that you don't know about. That's creating a lot of inflammation. Stress creates a lot of inflammation. So getting a handle on your stress load is important. Getting back to toxins, ruling out heavy metals, environmental toxins, molds. These are the things. So we have a very kind of meticulous checklist that we go down to see, does this make sense for this person? Does this make sense for that person? Another one is your oral health. So if you're somebody who's afraid to go to the dentist, we need to handle that, because you can have bleeding gums, you can have inflammation of your gums. It gets into your entire bloodstream and puts you at risk for this. So inflammation, number one. Number two, we mentioned the toxins. Number two has to do with your diet. So Dr. Bredesen, again, who wrote the book, The End of Alzheimer's, he likes a Mediterranean style diet. So do we. And you've got your healthy fats and your fish and your lean protein, plenty of fruits and vegetables. It's a beautifully well-balanced diet that is very healthy. It's very low glycemic. So one thing that he really appreciates is that a high glycemic diet, so a high sugar diet, a high refined food diet, a high simple carbohydrate diet, that is the enemy. So many of us agree on that. So that's something that we then really push and design a diet and lifestyle that really suits that. And you feel great on a diet like that. But you make sure you don't have any food sensitivities. Another book I wrote had to do with gluten and the gluten effect, and Dr. Bredesen very much is a proponent of making sure that if somebody's sensitive to gluten, it gets out of their diet. That tends to happen anyway on a low glycemic diet, but you really want to know if gluten is a bad guy, because it creates a lot of inflammation and a lot of neuroinflammation. So gluten is very linked to neurologic inflammation just on its own. Okay, so then there's hormones. We talked about 2/3 of women versus 1/3 men having this disease, but balancing not just the sex hormones, but thyroid is very, very important. And it really was Dr. Bredesen back in the day, so I'm going back probably at least 20 years, that reminded us that our brains, the cells in our brains, have receptor sites for sex hormones. And there was too little attention being put on hormone levels in older adults. It's like, okay, you're done having children. What does it matter? And it does matter. It matters for a lot of different reasons, including bone health and cardiac health, but it matters a lot for your brain health. So maintaining an optimal physiologic level of sex hormones is something that's very neuroprotective. It's very protective for your brain. So those are some of the major points I wanted to go over with you. And I talked to you about everything I wanted to talk to you about. I think what's really critical here is to appreciate that this is a systematic approach through systems of the body. So are you pre-diabetic or diabetic? Do you have coronary risk factors like high triglycerides or low HDL, the good cholesterol? Are you overweight? Are you on a poor diet? Exercise is really important for prevention of Alzheimer's. That's another thing Dr. Bredesen really stresses. I mentioned earlier the stress profile in your life, just your day-to-day stress. Sleep is something I haven't mentioned yet, which is huge. So optimizing sleep to get ideal sleep quality. There's quantity, there's also quality. I think I've shown my Whoop band often in videos, but it was something that was huge for me. I got it probably 4 or 5 years ago, and I was someone where it's like, okay, I'm giving you 8 hours, just you're getting what you're getting, and I don't want to hear about it, you know. But then I learned by having this device, and there's other devices that do similar things. I learned that my quality wasn't great. So then I kind of went to work on things that would improve the quality, improve the amount of deep sleep and REM sleep and not so much light sleep. And it made a huge difference in my health. So I want you to look at this. If you are in your 40s, it's definitely a good time to look at it. If you're even in your 30s and you feel like you're having some cognitive changes, it is a real thing. It's not something like, oh, you're way too young for that. You're not. It's 20 years in the making. If it's in your family, don't freak out. Don't feel like, you know, the ostrich and put your head in, you know, the sand about it, because there's so much that can be done. And Dr. Bredesen says even once diagnosed, you have a 10-year window to turn things around. And we've had some beautiful success stories here at the clinic of individuals that were barely speaking that completely turned around. So it is never too late. And again, if it's in your family, you want to jump on it sooner. And we can help you through these, you know, I mentioned a lot of different things, and what's appropriate for you, that's what we'll figure out. Like maybe you have great oral hygiene, you have wonderful teeth. That's not it. Okay, so then what is it? We'll figure it out, we'll optimize it. And again, not only will this move you away from Alzheimer's, it'll move you away from really all the degenerative diseases you want to avoid. So if you like this information, please subscribe to the channel. We're definitely trying to get more people to see this information. So we would love it if you would subscribe, give it a thumbs up if you like it, tell others, because I do want to help as many people as possible. Okay, we'll talk soon.